Lumbar disc herniation, or LDH, is a widespread health issue that affects millions globally. It often leads to significant pain, limited mobility, and can have a major impact on daily life and work. The economic burden is substantial, with billions spent annually on treatments and surgeries. But what exactly is LDH, and why does it matter so much? In this video, we'll explore the basics of LDH, its symptoms, and why finding effective, less invasive treatments is so important for patients and healthcare systems alike. When it comes to treating lumbar disc herniation, patients and doctors often face a choice between conservative and surgical approaches. Surgical intervention can provide quick relief, but studies show that long-term outcomes are often similar to those achieved with conservative care. Conservative treatments, such as physical therapy and interventional pain management, are increasingly favored, especially for those looking to avoid surgery. The trend is shifting towards less invasive options, aiming to manage pain and improve quality of life without the risks associated with surgery. One fascinating aspect of LDH is the phenomenon of spontaneous resorption. Since the 1980s, researchers have observed that herniated discs can sometimes shrink or even disappear without surgical intervention. Multiple studies have reported high rates of spontaneous regression, with some meta-analyses suggesting rates as high as 70%. This natural healing process is believed to involve inflammation, immune cell activity, and changes in blood vessels within the disc. Understanding this process is crucial for developing better, less invasive treatments. Inflammation plays a central role in the resorption of herniated discs. When a disc herniates, the body's immune system responds by sending macrophages and other cells to the site. These cells help break down and absorb the extruded disc material. Factors like vascular endothelial growth factor and fibroblast growth factor 2 are involved in forming new blood vessels, which further supports the healing process. However, the exact impact of interventional pain management treatments on these mechanisms is still not fully understood. Interventional pain management, or IPM, refers to a range of minimally invasive procedures designed to relieve pain. For LDH, common IPM treatments include epidural steroid injections, facet joint blocks, and nerve blocks. These procedures aim to reduce inflammation and block pain signals, providing relief for patients who may not be candidates for surgery or who prefer to avoid it. But do these treatments actually help the disc heal, or do they simply mask the symptoms? The main goal of the featured study was to evaluate whether IPM treatments, particularly epidural steroid injections, influence the size of lumbar disc herniations over time. Using MRI scans, researchers tracked changes in disc size before and after IPM procedures. The hope was to determine if these treatments could promote disc resorption, potentially offering a non-surgical path to recovery for many patients. This retrospective study analyzed data from 449 patients who underwent IPM at King Abdullah University Hospital between January 2022 and January 2024. To be included, patients needed at least 2 lumbar spine MRI scans, one before and one after IPM. The study excluded those who had surgery after IPM or whose MRI scans were too far apart in time. Ultimately, 128 patients met the criteria, providing a robust sample for analysis. The study group included 65 females and 63 males, with an average age of 52.6 years. Patients were divided into 3 age groups, 25-45, 46-65, and 66-85. Most had multiple herniations, while a smaller portion had single-level herniation. This diverse sample allowed researchers to examine whether factors like age, gender, or herniation status influenced treatment outcomes. Among the 128 patients, 37.5% showed a reduction in disc size after IPM treatment, while 62.5% saw no significant change. Interestingly, resorption rates were similar between males and females and across different age groups. The highest resorption rates were observed in patients with single-level herniation and those with longer follow-up periods after treatment. The timing of follow-up MRI scans played a role in observed resorption rates. Patients scanned 6-9 months after IPM had the highest resorption rate at 50%, while those scanned earlier showed lower rates. This suggests that the body may need time to process and resorb herniated disc material, and that longer follow-up periods could reveal more positive changes. Not all herniations are equal. The study found that herniations at the L5-S1 level had the highest resorption rate, followed by L4-L5. This may be due to the unique anatomy and stress on these segments. Patients with single-level herniation also had better outcomes than those with multiple-level involvement, highlighting the importance of individual disc characteristics in predicting treatment success. The body's ability to resorb herniated disc material is complex. It involves immune responses, inflammation, and the formation of new blood vessels. Interestingly, while steroids used in IPM reduce inflammation and pain, they might also slow down the natural resorption process by inhibiting some of these immune activities. This dual effect means that while patients may feel better, the underlying disc may not heal as quickly. Gall research. This study had its limitations. The sample size was limited by the number of patients who returned for follow-up MRI scans. The study also focused on changes in disc size, not on detailed measurements or clinical symptom improvement. Other factors, such as physical activity, lifestyle, and adherence to therapy, were not fully explored. These limitations highlight the need for more comprehensive, prospective studies in the future. Findings suggest that while IPM can help reduce pain and may contribute to disc resorption in some patients, it should be part of a personalized treatment plan. Conservative management, including physical therapy and lifestyle modifications, remains the first line of treatment for most LDH cases. Surgery should be reserved for severe cases or when conservative measures fail. Understanding patient-specific factors can help tailor the best approach for each individual. Summary: interventional pain management offers hope for patients with lumbar disc herniation, but its impact on disc resorption is modest and varies between individuals. The study underscores the importance of further research to optimize treatment strategies, combining pain relief with approaches that support natural healing. By focusing on personalized care and ongoing research, we can improve outcomes for those living with LDH.